Yeah. So, as we are talking about the distal radio ulnar joint, so move your joint in a pronation, and you see that with pronation, you are moving your arm in the anterior direction. So, which glide I should give to the patient to increase the pronation at the proximal radiohumeral joint? Anterior, because who is moving? Convex radial head is moving on concave ulna, radius on ulna. So with pronation, you are moving your arm in the anterior direction and gliding is in the opposite. Now do the supination. Supination, you are moving your arm in the posterior direction. So which glide you should give to increase supination at the proximal radio ulnar joint is anterior. Okay. So shoulder joint is opposite. Then radiohumeral joint is same direction. The proximal radiohumeral joint again is opposite because convex is moving. Now the distal radioulnar joint then again in the same direction. Okay. So what happened at the distal radioulnar joint? You can see the distal radius. Now the radius is concave and ulna is what? Convex. So now concave is moving on convex. So what happened? Do the same. Do the pronation. Now, if you are talking about distal radioulnar joint, then I know it is going to be in the same direction because my concave radius is moving on the convex ulna. So with pronation, if I'm moving my arm in the anterior direction, then I should glide anterior direction. If I do pronation, I'm moving my arm in the pronation direction. I know my concave radius is moving on convex ulna at distal radioulnar joint. Then I should glide posterior direction. Okay. So shoulder is the opposite. Everything is happen at the opposite level. Radiohumeral joint, everything happen at the same. Everything means rolling and gliding happen in the same direction. Then distal ulnar radial joint is opposite direction. Proximal radioulnar joint is opposite direction. Now the distal ulnar joint is in the same direction. So we finished four joints. Okay, two in the same direction, two in the opposite direction. Now let's talk about the wrist. What is wrist? What happened at the wrist? Now the carpal's bone are moving on radius. Carpal's bone moving on radius. So radius is, see, what is the surface of radius at distal this joint? Concave. Now the radius is concave and the all the scaphoid, lunate, the proximal carpal row is convex. Okay. So at wrist joint, convex is going to move on concave surface. Now, if the convex O opposite direction, so what happened? I'm doing the flexion. I'm doing this flexion. Tell me, I'm moving my joint in the anterior direction. I'm moving my joint in the anterior direction, forward towards the wall, because with flexion. Okay, so which glide I should give? Because my carpal is moving, convex is moving, everything happen in the opposite direction. I should give glide in the posterior direction to increase the flexion. Now I'm doing the extension. I'm moving my arm in the posterior direction. I'm moving my arm in the posterior direction. Then I should give anterior glide. Okay, anterior glide. Now we did the flexion and extension. Now we'll do the ulnar deviation and the radial deviation. Ulnar deviation, I'm moving my thumb towards the ceiling. I'm moving my hand towards the ceiling. That is radial deviation. If I'm moving my arm towards the ulnar level or ulnar direction, then which glide I should give? I should give in the ulnar direction force this to increase the radial deviation. Now I'm moving, going in the ulnar direction. I'm moving my arm in the at ulnar level, ulnar surface. So which glide should I give? Opposite radial direction. Okay. So wrist joint again in the opposite direction. Shoulder opposite, proximal radio ulnar joint is opposite, and wrist joint is opposite. The humeral radial joint in the same direction, distal radio joint is in the same direction. Now the next joint is hip joint. Hip joint is similar to shoulder joint. Okay, the acetabulum is concave and the head of the humerus is what? Convex. Now my convex surface is moving on concave surface. Okay, humeral head is moving in the femoral head is moving on the acetabulum. Convex femoral head is moving on concave acetabulum. Okay, so if I do the flexion of the lower limb, you are moving your leg in the anterior direction. So which glide you should give? Posterior. Do the extension to kick a ball, you are doing the posterior direction for extension. So which glide? Anterior. Okay, now do the abductions, the side kick. Do the side kick movement, you are moving arm in the outward direction or in the lateral direction, then you should get glide in the medial direction. Okay, and do the a deduction, the do the a deduction, the move your legs in the inward direction towards the midline, then glide is in the lateral direction. For the humeral, for the uh, femoral acetabular-femoral joint or femoral acetabular joint or hip joint. Okay. So the next is the knee joint. Knee joint is a tibiofemoral joint. And knee joint, as we know that you can see in the mirror, the femur is convex and the tibia is concave. So when the convex is moving on concave, everything going in the opposite direction. So at knee joint, the movement happen at two level. One is open kinetic chain and another is closed kinetic chain. So first I'm talking about open kinetic chain. I am sitting in a high sitting position. Okay. Now I'm moving my leg. In what happened in the open kinetic chain, the distal end of the limb is free. Like this. This is the open kinetic chain. If I fix my forearm on the another surface and then I'm doing this movement, that is the closed kinetic chain. So I'm sitting in a high sitting position, and let's suppose this is my femur, this is my tibia and ankle joint, and this is a knee joint. Let's suppose that I'm not able to perform the knee joint movement at this level. So let's suppose I'm sitting on a high chair, my leg is hanging. This is my femur, this is my knee joint. So I'm doing this movement. What is this? Extension. Okay, I'm doing the extension. I'm moving my distal leg in the anterior direction for doing the extension movement. So which glide I should give to the patient? My tibia is moving. My femur is fixed in this direction, and I'm moving my distal leg, the tibia. I'm moving my tibia. So as you see in the mirror, the tibia is concave. Concave is moving on convex. Concave. So everything going in the same direction. For extension, I'm moving my leg in the interior direction. So which glide I should give? Interior. Okay. For flexion, I'm moving my leg in the backward posterior direction. So I should give posterior glide to increase the flexion. Okay. So open kinetic chain for extension, anterior glide, and for flexion, posterior glide. So always move your limb. Always move your limb. See what is moving. Convex is moving, concave is moving. Second step. And the third step, I'll give the glide accordingly. If concave, the glide in same. Convex or opposite, glide in the opposite direction. Okay. Now let's talk about closed kinetic chain. We are doing the squats. Okay, we are doing squats. I'm going in the downward direction, going in the squats position. Okay, my femur is moving on tibia. Femur, as you see in the mirror, the femur, as you see in the slide, the femur is convex. The femur is convex. So my convex is moving on concave. So everything going to happen in the opposite direction. So with flexion, do the flexion. So with flexion, in open kinetic chain, with flexion, I'm giving the anterior glide. But in closed kinetic chain, I'm for increasing the flexion, I give the posterior. For flexion, I should give the in open kinetic chain, for flexion, we are giving the posterior glide, because my leg is going in the posterior, but in the closed kinetic chain, I will give anterior glide. Just do the opposite. Okay, whichever happen in the open kinetic chain, the posterior, the same the opposite of open kinetic chain. For extension, in open kinetic chain, I'm moving my leg in the forward direction. So I give the anterior glide, anterior glide. But in this, I will give the posterior glide in closed kinetic chain. Okay. Now, the patellofemoral joint. What happened at the patello? Because we know that na patellar is hypomobile in PFPA syndrome. So we should also give glide to mobilize our patella. As you can see in the mirror, the patella is what? Convex or concave? Concave. And the femur is convex. Okay, this is my femur. Let's suppose this is my femur and this is my patella. Patella is gliding superior, inferior, medial, lateral for the movement. Okay. So now there is a one trick also to maintain your leg in the neutral level in the high sitting and do the extension with me. And you see with extension, your patella is moving superiorly. Your patella is moving superiorly. So which glide you are going to give to the patient to increase the flexion? Move your patella superiorly. And if you am going in the flexion direction, my patella is moving inferiorly. To increase the flexion, I give glide, which inferior glide to the patient to increase the patellar mobility on femur. The next is talocrular joint. As I know that at talocrular joint, my plantar and dorsiflexion happen, and at inversion and eversion is going to happen. Okay, so at first see the what is convex and concave at the ankle joint. The talus is what? Talus is convex, and the tibiofibular joint and the distal tibia and distal femur is what? Concave. So what happened? My talus convex is going to move on the concave surface. Okay. So with plantar flexion, I'm moving my leg in which direction? So do the movement with me and tell me which direction you are moving. You are moving convex talus. You are moving your leg in the anterior direction. So you give the posterior direction glide to increase the plantar flexion and do the dorsiflexion. Do the dorsiflexion. You are moving your leg in the posterior direction. So which glide you should give? Anterior glide, because convex is moving on concave. Okay. For eversion and eversion, the concave talus, and the convex calcaneum. Okay. So with eversion and eversion, the same happen. Do the inversion. Convex is moving, do the inversion. I'm moving my leg in the inward direction. I'm moving my leg in the medial direction. Inward direction is medial direction. Okay. So which convex is moving on concave, I should give glide in the lateral direction. Okay. And I'm doing the eversion. I'm moving my leg in the outward. Leg means ankle. I'm moving my ankle in the outward direction. I'm moving my ankle in the lateral direction. So which glide I should give? Medial glide. Okay. So these are pretty information about the convex concave rule. And for this notes, I use the following books as a reference. The Krishna Kolbe Krishna, the therapeutic exercises, foundation and technique. The second, I use some images and some points from Maggie, and some images and some orthokinetic points from the Carol Ortiz kinesiology book, The Mechanics and Pathomechanics of Human Movement.